Hi everyone, this is Neil Reiter, consultant audiologist and director of ClearWax. Thank you for joining me in my latest video using the WaxScope. Here we have a patient who attended with really impacted earwax in both ears. That was their right ear that you just saw on screen, and this is their left ear. Their left ear is a lot narrower, and in both ears the earwax is impacted in the second half of the ear canal, so it's quite medial. So I'm just starting off with their right side. You can probably see where the suction probe is approaching the wax here. There's a slight indentation. That's where they used a Q-tip, or what we call a cotton bud in the UK. And it's quite dry. It's a bit matted as well. There's a few hairs there. I'm just trying to bring this through now in both ears, but more so their left side. The outer half of the ear canal is a lot narrower than the medial half, and this wax, because it's been pushed into the wider part of the ear canal, it's filled up that space, making it now larger than the outer half of the ear canal. So we're having to try and squeeze this through. So I'm just going to the top and trying to roll it down, but I think I'm going to use some medical grade olive oil spray in a moment to soften the surface, because it's quite matted and quite dry to begin with. It's very difficult to get a suction grip. But in both ears, I do end up using both the right, well, I think in the right side, both the right angled ear hook and the ear pick, and in the left side, the ear pick. So the oil just helps soften the surface to get a better suction grip, but it also lubricates the canal walls. So as we're trying to squeeze this through, there's less friction. Imagine you've got a ring stuck on your finger and using a bit of soap to lubricate your finger in order to remove the ring. It's the same concept. Now, currently in this right side, the specular we're using is our standard size specular, which is 4.25 millimeters. And in the left side, I do revert to our size 1 specular halfway through, because the ear canal is a lot narrower, and that's 3.5. We do have larger sizes as well, the 5 millimeter and a 5.75. Now we're beginning to relaunch our training courses for the WaxScope. Although I've had a course, I think I had 2 last month, 1 this month, and I've got 1 planned for next month. Haven't been advertising it until we upgrade our device to incorporate the iPhone 16e. So previously we were using the iPhone SE, the 3rd generation, but that's now obsolete. So we're just having to upgrade everything, so which means a new adapter. We also have to update our technical files, our ClearWax custom cases. So whenever there's a change of phone, it's just take a while, but we're nearly there now. So we're, in fact, I've launched a new training date on the website, but I think I think it's going to be fully booked already, that particular course, but we will be launching some new dates as well in due course. So I just used the right angled ear hook there, and although it didn't prise the wax out, it did dissect into it, so it's made it into smaller pieces. So I've managed to extract this piece out here. I think there's still quite a lot more, we shall see, yeah. And the tail end of this wax, obviously you can't see it, but it is almost up against the eardrum. Now I'm trying to tuck this wax inside their right hand side ear canal. You can see I've just reorientated it so it can squeeze through that narrow aperture. We managed to bring that through. So it got quite a bendy ear canal as well. So I'm just going to look at the eardrum. I'm going to increase the brightness. I didn't realise I had it a bit lower than usual, so I'm just going to increase that. But you've got a stunning view of the eardrum. You should see the brightness go up in a moment. There we go. That looks all nice and healthy. So we're moving on to their left side. So not only is their left side bendy, but it's also, again, quite narrow. That wax has been lodged into this second half of the ear canal. And this was a lot more difficult to remove. There's less maneuverability. You can see the suction probe. This is got an outer diameter of 2 millimeters. There's hardly any wriggle room left to right. So it just gives you an idea of how narrow the ear canal is. I would say this part of the ear canal is about 3 millimeters. Beyond the second bend, where the wax plug is, it's probably about 4 or 5 millimeters. and this plug has filled up that space. So we're trying to bring a 5mm, for example, size plug through a 3mm opening, which if the wax is really, really soft, it's not an issue because it will just suction away and break up in little pieces. But this is a solid lump. So I've just gone almost over the top of it because it's a bit more of a better surface here to get a suction grip. I'm trying to bring it forwards, but when you're performing the procedure, you can feel some resistance. Now, the wax plug, I wouldn't say it was adhered to the canal wall, but you can see it's moving around. And with this type of wax, you've got to be careful when you, for example, if you use forceps, you can't use forceps at the moment because there's nothing to really, the jaws are not going to go that wide from left to right. Well, they can go that wide, but you're not going to prize that because the wax is such that, particularly on the left-hand side, you're not going to get the jaws around the circumference of the wax plug. But even when you use an ear pick or curette or hook, when the wax is mobilized in the ear canal as it is, you can see it's freely moving around. You run the risk of accidentally pushing it further in. And even with suction, you've got to be careful. You almost got to hover over the surface. So I'm just trying to stretch open the ear a bit more. I'm still using our medium-sized specular. You can see the wax is looking a bit closer to us. So I've just gone in a bit deeper with the specular. And I'm just trying to go to the bottom. There's a bit of skin here. We're going to get that comes away. So it just makes the plug a bit smaller, and the ear is quite bendy. So as we're bringing this through, I'm having to bring the wax first to the right and then to the left around that second bend you can see on the left-hand side of the screen. You can see that I'm rotating it and trying to work with the curvature of the ear canals. At the moment, I'm trying to roll it out. I'm trying to go to the top and bring it down and then roll it. Sometimes that works really, really well, especially if the wax is spherical, but this is a longer piece. It's more like a log, so that rolling motion obviously doesn't work as well. And currently with the specular, although the last time I inserted it, I was able to dilate the ear, but on this occasion, it's almost collapsing. So if you put the pressure on the specular on the side of the canal walls and it's already narrow, it can close in the canal at the head of it. See, when I come out with the specular, the ear canal widens. So I'm just using our smaller specular now. I'm able to get that in a bit further and dilate it, and you can see the tail end to the top, which is going towards the eardrum a lot better now. So although you see more of the specular with the smaller size specular, you can actually see a bit more of the wax in a narrow ear canal, that is. Now, it's difficult using the ear hook because it was so narrow. It's difficult actually inserting it in such a way where you're not going to graze the canal wall. So I think I used the ear pick on this side more. I think I might have tried the ear hook, which we'll see in a moment. So again, I'm just trying to rotate it around that second bend, but because it's quite a long piece, as I'm bringing, although the surface of this wax, I'm trying to bring it right to left. What that means is the tail end of the wax moves to the right, and it's touching the right-hand side of the ear canal, and it's locking it in place. But I've created a gap there. So I'm using the ear pick because it's got a lower profile. I'm much better able to get that in. I'm just trying to embed it into this portion. Now, I accept at this point I'm not going to get all of it out, so what I'm trying to do is just break away the lateral piece, just make it a bit smaller. So I'm pushing that section out of the way and then slowly bringing it through. So it's in little pieces and crumbs, so I'm just going to probably suction that way, we shall see, or do I roll it out? No, I'm going to suction that way. It's still quite a challenge removing this. There's a bit of skin here at the base of the wax plug. But yeah, I'm just not getting a good suction grip. I could have potentially used forceps at this stage because there's a bit, I can see the left and right hand side of the wax plug, but because it's a mobilized plug, the worry is as you approach it, you may make contact with the tip of it and it's just going to push it further in. Obviously, because we're using a small speculate, it's a very small ear, it's very limited space in there. I had one yesterday of a child. Now, that was slightly different because the wax wasn't mobile in the ear canal. It was adhered, or it was dead skin, actually. And there's a perfect flap for me to grab onto. So with that patient, it was a 2-year-old child, actually. I wasn't worried about inadvertently pushing that further in because it was adhered to the canal wall. But this isn't adhered to the canal wall. And the tail end is possibly already up against the eardrum anyway. See, there's a lot of dead skin enveloping the sides of the plug, although the bottom and the top is completely free of any adhesive skin. But I'm not even sure that skin is actually attached to the wax plug. I think it's just there on the side of the ear canal walls. You can see in the distance the wax plug is quite deep. I just put some oil in, I think, just to soften this. And I'm trying to bring it down because, as I said, this plug is larger than this section of the ear canal. So I'm trying to wriggle it underneath the top part of the ear canal. It's just not moving. It's too big a piece still. Oh, I think I might have just managed to bring it underneath. But I think this section's going to break away, unfortunately, as opposed to the whole plug coming out. But nonetheless, we've made it smaller. And there's a bit more of a gap at the top. So I'm pretty sure I'm going to go back in with the ear pick in a moment. Because I've made it smaller, I've just gone back in with the suction probe just to see if I can wriggle it through now. There's a bit at the bottom. Yeah, but it's just not wriggling through still. I'm just going to drag it out so we get a suction grip and then pull out. Oh, I think we're getting some movement here now. I'm just rocking it left to right, trying to squeeze it through. See, there is skin there. I'm pretty sure I've used the ear pick again. Maybe I'm mistaken. I thought I did. But no, it looks like I managed to remove it with suction, unless there's a little bit left, we shall see. So it's just trapped now between the first and second bend. So that flesh on the right hand side, that's the first bend. Again, I've got to move it from right to left. Now I managed to get it out there. So yeah, even with the small speculate, it's very difficult to get a full view of the eardrum. Well, we managed to do it, but because the outer half of the ear canal is so narrow. So with our medium-sized speculate, we wouldn't have been able to get that view. Just focusing on different parts, you can see there's a bit red there, so that's probably where the plug was slightly attached to the canal wall. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.